Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Mirizzi syndrome. So what is Mirizzi syndrome? Here, the gallstones, it becomes impacted. So the gallstones, it becomes impacted, and this is present in the cystic duct. It is present in the cystic duct or even the neck of the gallbladder or in the neck of the gallbladder. So this produces a CBD obstruction as well as jaundice. So it produces a CBD obstruction as well as the jaundice. So there are some modalities such as the ERCP, the PTC as well as the MRCP. So they will usually demonstrate the characteristic extrinsic compression. So they show mainly the extrinsic compression, and this will be of the CBD, common bile duct. So let's recap what we did here. We saw the Mirizzi syndrome. So here what happens is the gallstones, it gets impacted in the cystic duct or the neck of the gallbladder. So this leads to the CBD obstruction, common bile duct obstruction, as well as the presence of jaundice. So the modalities, there are ERCP, PTC and MRCP. They form the extensive components and extensive compression of the CBD. So this features, it can be seen. Next is the surgery. So what does the surgery contain? So the surgery, if you see, it contains the removal of the cystic duct. So there is removal. There is removal, and this is of the cystic duct. Cystic duct, and also the diseased gallbladder. There is a diseased gallbladder, and also the impacted stone. So the surgery, it contains the removal and of the cystic duct. Next, the diseased gallbladder as well as the impacted stone. To learn and grow daily like this, please do subscribe.